Welcome to Black Health, a weekly talk show discussing medical issues affecting and impacting the Black South Florida community. Now introducing our host, Dr. Michelle Kirwan Blackwood.
Hello, thank you so much for joining us and welcome back to Black Health, a platform to discuss health issues affecting the Black community. I am your host, Dr. Michelle Kirwan Blackwood. I'm a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens, Florida. Today, we will be talking about pediatric physical therapy, including for children with developmental disabilities, injuries, and after surgery, with Dr. Lafonda Beneby. Dr. Beneby, thank you so much for joining us today.
Hi, Dr. Blackwood. Thanks for having me.
Absolutely. I'd like to take a moment and introduce you to our audience. Dr. Lafonda Beneby graduated from FIU University, Florida International, with a bachelor's degree in physical therapy in 1997. She completed her doctorate in physical therapy at A.T. Still University in 2012. She began her career in acute care and outpatient care, providing therapy for adults and children with orthopedic, neurological, and wound care disorders. She continues to provide services as a school-based physical therapist, private home health therapist, and became a tech founder, which we will talk about a little bit later in the show. So thank you again for joining us, Dr. Beneby. Let's go ahead and get started. What is pediatric physical therapy, and how does that differ from therapy for adults?
Well, pediatric physical therapy is therapeutic interventions that include things like manual techniques. It also includes exercises, age-appropriate activities, as well as activities that emphasize balance, strength, and coordination with regards to gross motor skills in the developing child. And so the difference between that for adults is that those skills are targeted for a developing child as opposed to an adult who has a specific ailment or issue trying to get back to regular function.
How does physical therapy differ from occupational therapy? Because they seem to be very similar to many people. And so I get that question a lot. Well, what's the difference between OT and PT? So what is the difference?
We hear that a lot in the school system, and the easiest way for us to explain that to parents and people is it's like cutting the body in half. The therapist typically deals with the gross motor skills, the walking, sitting, moving, and the occupational therapist deals with the fine motor skills, those skills that are required to use your hand, like dressing and feeding yourself and moving your hands to write or carry things. And that's the difference between OT and PT.
I think they commonly call that the activities of daily living, right?
Daily living.
Yeah, for occupational therapy. So what is the youngest age a child can start receiving physical therapy? I think most parents think of pediatric physical therapy as, you have to be able to work with the child. So they have to at least be able to understand 4 years old, 5 years old. But you go down much younger than that, don't you?
We absolutely do. There are times that babies that are born premature or those babies that end up in the NICU require certain attention in terms of assessing their positioning, their ability to respond to stimuli. And so babies can be seen in the NICU as early as shortly after birth.
And NICU, for those who may not know, is the NICU?
Neonatal Intensive Care Unit.
Yes, we get used to using our acronyms.
Yes.
Sometimes people get lost. So what are some of the most common conditions or challenges that children might face that require physical therapy?
Some of the common ones I've seen in my years of practice are your cerebral palsies, your autistic spectrum disorders, Down syndrome. You also have your spina bifida and those variety of other syndromes like their Carnelia de Lange, those developmental disorders or genetic disorders that present with issues in balance and coordination. They have difficulty with their motor control. They may not be able to actually coordinate their limbs like the normal child does. And so those are things that are also affiliated with muscle tone, whether the muscle is too tight or rigid, or the flaccid or floppy babies.
Okay. What about working with children with special needs? Is there a different approach? You mentioned some of those kids with special needs, autism, Down syndrome. Is there a different approach working with a special needs child versus a child that maybe speaks well, has no special need per se, but maybe is just a little delayed with their development and just needs a little extra help?
Yes, there's definitely a difference. And the difference that you have to be aware of as a clinician and a therapist is their cognitive level. Because when you're approaching a child with a developmental disability, their ability to comprehend and process what you're saying in order to reproduce a movement may be a little bit different than the average child. So, for example, if I wanted the average child who understood me to do, let's say, 10 reps of squat, that'd be different for a child who has a cognitive impairment to understand exactly what I mean, even if I demonstrate it. So,
Mhm.
creative way would be to put some toys on the floor and have a basket on top of the table and say, "Can you give me the toy and put it in the basket?" And so I've effectively had that child to squat down and pick up 10 items 10 times in
Mhm.
the basket. I've achieved the same movement just with a different approach, being a little creative.
Okay. Yeah, creativity helps. You mentioned earlier injuries. So we spoke briefly about injuries. And I was just curious about what types of injuries you work with and in working with athletes. What type of work do you do working with athletes, or does a physical therapist do working with athletes?
When we're talking about athletes, and it's specifically concerning with the young athletes, we're looking at those that play football or basketball or your softball. You're typically looking at your ACL repairs or your ankle injuries and sometimes your shoulder injuries. And so those are common things that are happening when we talk about the competitive edge that's happening now in the high school. And the interesting thing with that is that now the kids are offered these NIL deals
Mhm.
early on in high school, just before graduating. And so it's very imperative that the parents are understanding that just placing your child on the team may not be enough. It's going to be prudent for the longevity of their career to make sure that that child is properly trained and conditioned before they walk onto these fields with these coaches.
Yeah, I think that's such an important thing. I played sports growing up, and I'm sure things are different now. But I don't find that high school athletes get the proper care for injuries. They seem to maybe do a little bit of physical therapy or see a chiropractor
Mhm.
briefly, and then they're thrown right back into the game. I think the same thing probably happens on the college and the football level in terms of getting right back in the game, but they have, I think, far more structured and more robust physical therapy and other therapies available to them. So I think what you're saying, especially with NIL and money on the table for these young
Mhm.
athletes, can really change their lives and their families' lives. It's really important to for them to get the proper rehab and the proper physical therapy. So I'm glad to see that physical therapy is addressing that and seeing that need in these young students.
Right. It became a personal issue for me because last year my child decided she wanted to enter sports and not, she had a natural talent, but had not been conditioned. And it hit me when she went on the field after a couple practices for them to try and compete. And like the conditioning was not preparing her for what she needed at a competition level, which means that she was going to be predisposed to injury. And that's when it, hit home for me as a mom. And number two, as a therapist, that it's important that these kids are trained properly, conditioned properly, and educated on what it is necessary to kind of prevent some of these injuries.
Yeah, I can tell you from personal experience. I played volleyball through high school, and then in college, and that transition from high school to college was brutal. When you talk about
Mhm.
training,
Mhm.
completely different
It's
level.
totally
So,
different.
what are some signs that parents can look out for to identify if their child may benefit from physical therapy? So, somebody watching this saying, I wonder if little Johnny needs extra support. What are they looking for?
So if you're a parent and you're looking at your child and you notice that the muscles or their muscle tone, when I say muscle tone, they seem to be a little stiff, to put it in layman's terms. They seem to be rigid in terms of their movement of their limbs. Or if you notice that they're extremely lax and flexible, more than the average baby. You also would notice those babies that are up and about and seem to be frequently falling once they get to the walking age and they learn how to walk, and you see a little unsteadiness in their gait. Or also if you decide or realize that once they've reached certain ages, there's some developmental milestones that they're not hitting on target. Those babies should be between 1 to 3 months. They're on their elbows, on their belly, able to hold their head up. If by 4 months you're not seeing that, that's a bit of a concern. If that baby's not able to roll from their belly to their back 3 to 4 months, those things are a bit of concern. So knowing, having an idea of what the developmental milestones are and seeing if your baby's on target, those are times to kind of raise a red flag with your physician and say, hey, let's see if, he needs an intervention to get him on task.
Yeah, and to support the parents, the pediatrician is trained to look for those things and ask those
Mhm.
questions and evaluate those things as well, and then refer to physical therapy if we see
Right.
fit. Now, depending, we need to take a quick commercial break. So if you are watching Black Health today, and we are talking to Dr. Lafonda Beneby, pediatric physical therapist, and we will be right back.
Down here in South Florida. So for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids matters because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. Demesman and Dover Law Firm, youraccidentattorneys.com.
At DRT Behavioral Services, we provide culturally sensitive mental health evaluations with thorough treatment plans, incorporating alternative forms of wellness, not just Western traditional medicine. Besides medication management and psychotherapy, we provide education to people in the areas of minority mental health with classes on your diet's impact on mood and sleep hygiene for better rest. We also offer weight loss therapy, massages, and facials. Visit brainlovehelp.com today.
Welcome back to Black Health. We are talking about pediatric physical therapy with Dr. Lafonda Beneby. So if you have little ones in your life, please stay tuned. We're learning some great things today. Dr. Beneby, what role do parents play in their children's physical therapy journey? How can they support their child's progress best?
Parents play a crucial role in the journey of physical therapy because it's not just what we do in the sessions, it's what we teach you in those sessions that carry on outside that's going to get the optimum results with the children. So it is best for parents to stay engaged and involved in order for the best results and progress for your child.
Good. Are there any misconceptions about physical therapy that you often encounter?
Working in the school system, I've gotten a couple of people who just see me working with kids and they're like, you just play with the kids and you walk with them. Anybody can do that, right? You just get a certificate somewhere, is what someone actually said to me. And I'm like, no, that's
Ooh.
false. It requires a physical therapy license, and we're trained to assess what's being affected and what specific activities and interventions are chosen to address and correct a problem. So it looks like we're just playing, but we have targeted things that we're working on as strategies to kind of correct those problems.
I understand that many people consult Dr. Google now, so I'm feeling a little useless at times. But how about cultural factors? Do those influence the way parents perceive and engage with physical therapy?
Yes, some of the cultural factors is just awareness and education on what it is that we actually do. Some of the cultural beliefs about, medical intervention and things of those natures. There's some people that don't really trust the medical community all that well. And some of them just are not aware of our expertise. And so those things kind of impact their respect level and their compliance with what it is that we recommend and suggest.
How about socioeconomic status? Does that impact access to PT services?
Yes, ma'am. I see it a lot because some of the schools I'm assigned to are in a lower socioeconomic area. And so those things are impacted when a parent needs to prioritize those basic needs of taking care of the child's food, clothing, and shelter and may not have a whole lot of time and resources to begin with. And so they begin to prioritize whether they're going to add on seeking out and doing physical therapy outside of the basic needs of that child.
Hmm. I want you to speak to early intervention because sometimes I have parents who feel like their child. I'm recommending physical therapy, and they feel like my child is normal. She's just a little bit slower than the other kids, but I think it's okay. She'll catch up. She'll be fine. Speak to early intervention and its impact on long-term outcomes.
The reality is that there are situations where children will catch up, but you are putting the child behind the eight ball the longer you delay things. And see, the earlier that you get them into interventions that kind of work on those issues and problems, the more progression that they can make in terms of leveling out their playing field and getting on target. So when you're delaying your intervention, you're delaying that child's progress and optimal function.
So one thing I mentioned in the beginning of the show is that you are a tech founder. So tell us about the app that you developed during COVID, apparently, to facilitate virtual and in-person physical therapy?
My app is called the Kids in Motion app, and it was developed and launched during the COVID episode simply because we had the shutdown and we were not allowed to access our children at the time. And so parents were concerned with their children regressing and also having the services. And luckily, we were deemed as necessary, and the state granted us access to be able to authorization to be able to deliver our services during virtual, during telehealth, through telehealth. And so it's an all-in-one physical therapy app where you are using video modeling to emulate gross motor skills, and kids will continue to engage and interact with those activities while they're exercising and working on their skills.
Give us an example of what type of video, or what is it that you're using, or what is it that the child sees, and how do they work with that?
Okay, so one of the examples we have is on a level 1, we have a toe touch video where the child is standing upright and they go and they reach down and touch their toes and come back up. And so they're repeating that for a period of 1 minute to work on their ability to be flexible, control their balance, and return to an upright position. And that allows the therapist as a user to assess the child's functional level, their stability, and their endurance. And so you can do a brief record of that child performing it. So you have a baseline assessment of where they are. For the parent, they visually have a tool that they're using to practice with their child. So they know what it is that the therapist is recommending. And the child has an animated music video that will gain their attention because it has music and it's animated to keep them engaged to work on those basic gross motor skills.
So this is an app that parents can use on their own outside of the therapist being there?
Yes, ma'am. And the therapist will recommend specific videos for that mom or dad, and it's going to be sent to them. And this is what you pull up on the app and you work through those activities.
How difficult is it to navigate? And some people are not very techy, and they may think that it's going to be too challenging for them. And to be honest, I had a patient talk to me about, mention to me that she was doing her physical therapy virtually. And I was kind of skeptical. I was like, does that work? So now I'm glad to be here talking to you about it. This really is a thing.
It is a thing.
But how difficult is it to navigate the app?
Well, the Kids in Motion app is an easy to operate app. Once you log into the app, the menu is pretty much laid out with the functions of it, whether there's a calendar or the section for messaging your therapist, or it's going directly to the video. So it's very simple. And the reality of where we're going since COVID is now that there are companies that are contracting PTs for virtual only. So it is definitely a thing. It is definitely doable. And of course, there are still situations where those babies have to be handled. They have to be have to be facilitated with hands-on. So that won't change. But the alternate thing is, and what we realized during COVID is, it requires the parents to be involved. And so we're having the parents to use those same skills in terms of where you place your hand, how do you position that child to get optimal function. So ultimately, yes, physical therapy can be delivered remotely and effectively.
And I imagine it's empowering for the parent too, to now really have a role in their child's therapy and have some tools to work with the child on their own. So I can see it being a good thing for them. And then you mentioned being able to track the child's progress with the app as well.
Yes. And so the other features is that it allows you to upload a video so that you have those as baseline. We also have what we call a status report, and it gives you each section that you've assessed so you can make your comments and reassess in 6 months. So you have your baseline with your documentation daily and your status report to be able to track your child's progress.
Can you track compliance, the patient's compliance?
Yes, we have neat little features. When I log onto my app, if I prescribe specific videos, I can go into that assignment for that particular child, and it will show me if it's been seen, which means that the parent is at least logged on and seeing the assignment. Now, whether they've done it or not, we can see it once I go online. It'll show video completed. Now, if for some reason they have not gotten the chance to complete their assignment before the due date, once they do log on, I'll get a notification on my phone that Bobby has not completed their assignment.
So you can keep tabs. I like that.
Absolutely.
And what about things like scheduling appointments or just touching base with the therapist? Can parents do that through the app as well?
Absolutely empowering. Once they log into the app, if they want to schedule or request a meeting for us, they'll click on their profile and it'll drop down a meeting. It says request a meeting. If they want to send us a message, again, those menus options are there. It says messaging. They could send us a text message. If they want to share with me a video of the child doing whatever it was that I prescribed, they can also upload that and send that to me as well.
Amazing. Kids in motion. So it's a fabulous addition to physical therapy services. I love it. We do need to take another quick commercial break. You're watching Black Health. We will be right back.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman and Dover Law Firm, youraccidentattorneys.com.
At DRT Behavioral Services, we provide culturally sensitive mental health evaluations with thorough treatment plans, incorporating alternative forms of wellness, not just Western traditional medicine. Besides medication management and psychotherapy, we provide education to people in the areas of minority mental health with classes on your diet's impact on mood and sleep hygiene for better rest. We also offer weight loss therapy, massages, and facials. Visit brainlovehelp.com today.
Welcome back to Black Health. We are talking about pediatric physical therapy. Dr. Lafonda Beneby is here with us today. She has her doctorate in physical therapy. So we were just talking about Kids in Motion, your app, your virtual app to do virtual physical therapy. Is virtual physical therapy via the app, do you think it is as effective as in-person therapy?
I do. And it also depends on a case by case basis. But overall, the experience I've had with majority of my caseload and when the school system required that we continue to do the telehealth, it is effective. The key caveat is depending on the functional level of the child, whether the parent has to be in to physically support them. For us, we basically use the parent's hands, but it is absolutely effective.
Yeah. I love this addition because traditionally, probably when I first started practicing physical therapy was at a physical therapy office. And then I started hearing about it being in the schools and then in the homes. And now it can really be in the home virtually, and the parent doing it on their own time as well. So that really allows a lot of flexibility. Right. What advice do you have for parents who are navigating the healthcare system to access physical therapy services in general for their child?
The biggest piece of advice I have is that you're with your child for hours during the day, and your doctor will see your kid during an assessment or a visit for probably 15 to 30 minutes. And I don't know, Dr. Blackwood, you may give me a correction on that time period, but the important thing is to go into those doctor's visits with notes on what your concerns may be as you watch your child develop in between those appointments, and have those things written out so that when the doctor comes in, they're the things that you notice, because they may not see everything that you've seen at home. And so you're active and proactive in kind of pointing those things out to the physician to get facilitation as to what it is that your child needs to develop.
I would say the 15 to 30 minutes, generally speaking, is correct. But my patients, they're a little bit spoiled. So they know Dr. Kirwan Bythewood spends a little bit longer in the room with them. I can't help it.
But that's a good thing.
It is a good thing. How do you approach, well, it's a good thing, except for my CFO may not think sometimes it's a good thing. How do you approach building trust and rapport with kids who might be resistant to therapy initially, especially maybe those with developmental, special needs and might have a little difficulty adjusting to physical therapy?
My approach is to approach a child with gentleness, interact with them on their level, and to engage them with child's play before immediately trying to get into a therapeutic intervention. Because if it looks like play, the kids are more likely to engage with you rather than if you feel like you're just working or doing a task. I've had a lot of colleagues who are just rigid in trying to get things done right away, and then the kids just react, they cringe, and they sense that. But if you go with a sense of gentleness and like compassion and care, as opposed to just working on something to get something done, kids feel that. They feel that connection.
That's very true. That's very true. Can you discuss the importance of collaboration between physical therapists like yourself, educators, pediatricians, other healthcare professionals?
I think it's very important to take a multidisciplinary approach to cover a child because you're covering it from all vantage points and you're treating the whole child, like the medical aspect from the physician versus the functional aspect from the therapist, and the teacher is looking at their attention or their posture or how they engage. And so once you take all of those aspects together and put our heads together, we can treat the whole child as opposed to just treating in part.
And looking to the future, what advancements or changes do you hope to see in your field?
I hope to see more integration of technology into child care and gross motor. I've seen things like exoskeletons used for our neuro patients, and I'd want to see that more so for our children who are learning to walk or who are debilitated to the point where walking may not be a full reality without some type of aid. I'd love to see more innovative wheelchairs and augmentative communication devices. And so these babies are there in these bodies, but they are real people and they have personalities, and they just need help to kind of bring those out. And technology evolution is helping to bring that about.
Wow, amazing. Dr. Beneby, we're at the end of our time. I wish we had more time. I feel like there's so much more that we could discuss, but I just want to thank you for being on our show today. And how there's a parent watching now whose child needs physical therapy. How do they reach out to you?
You can find me on my social media platform. It's kidsinmotion.com. You can also reach me by email, and that is at lbeneby@therapyinmotionpa.net.
Awesome. Thank you so much. You've been a wealth of information today. It's been a wonderful conversation. Thank you for all that you do. And thank you for your app. I think that's an amazing addition to physical therapy services that parents, I'm sure, are very thankful for. And thank you to all of you who are watching Black Health today. We will see you again very soon. You can follow me at Black Health Show. Thank you again and have a great day, everybody. Bye-bye.
Thank you for having me.